Bismillahirrahmanirrahim. This is Dr. Usman Akhtar and welcome to my YouTube channel. Today we are talking about sickle cell disease, or we can say sickle cell anemia. So sickle cell anemia is a type of autosomal recessive disorder where there is mutation occur in HBB gene, which is hemoglobin beta globin chain gene, and causes hemoglobinopathy. Okay, let me split this definition into small parts. First of all, we should know what is autosomal recessive disorder. Autosomal recessive disorder means when there is both parents are carrying the abnormal gene. There is 25% chance in each pregnancy that one baby can have this proper disease and one baby can be normal, and 25% or 50% baby can be carrier as well. Another is HBB gene. So HBB gene, hemoglobin beta globin chain. So before going into the topic properly, let me explain what is occurring in the pathogenesis of this disease. So this is a adult hemoglobin we have, which consists of alpha chain and beta chain. When a baby born till up to 4 to 6 months, the baby survive on hemoglobin F, where there is alpha chain and gamma chain. But after 4 or 6 months, the beta chain take over, or the gamma chain. So in this beta chain, in case of sickle cell disease, at amino acid number 6, there will be valine amino acid will replace on glutamic acid. This amino acid, which is valine, is now incorporated in this position number 6. So this hemoglobin we call sickle hemoglobin or hemoglobin S. So this is the main problem in the sickle cell disease, and will cause hemoglobinopathy. Look at the clinical feature. The first of all, let me explain the hemoglobinopathy. Whenever there is hemoglobin S, so whenever such patient exposed to dehydration or hypoxia or infection, this hemoglobin they shrink and become sickle shaped. So this sickle shaped hemoglobin, they are very susceptible for the death of the RBC. So these RBC, their lifespan become very short, and these RBC undergo hemolysis very quickly and very early lifespan of RBC. So it will cause hemoglobinopathy. It is one of the condition of severe hemolysis. Whenever there is severe hemolysis, there will be anemia, there will be jaundice. So despite of these things, let me explain some other very important clinical feature of sickle cell disease. So another one is hand-foot syndrome. Let me tell you before. This is, for example, this is a blood vessel, small blood vessel. So whenever these RBC, because their shape is sickle shaped, so whenever they pass from a small blood vessel, they become they clamp together and they block these small blood vessel. So the further blood supply become compromised to that structures. So they for example, there is hand foot, like metacarpal or carpal bones. They or we can say a dorsal bone or metatarsal bone, they become hypoxic and later on they undergo through necrosis. So the patient suffer from severe pain in the hand and foot small bones, which is also called acute dactylitis. Acute dactylitis. Another is aplastic crisis. So in sickle cell anemia, when the parvovirus B19 infections occur, it causes a red cell aplasia. This is in fact a misnomer. This is not aplastic crisis. We should say this is a red cell aplasia. Only the RBC will not form. there will be only a red cell ablation, not all lineage will be normal except RBC. So aplastic crisis and sickle cell anemia is caused by parvovirus B19. Another is vaso-occlusive episodes, and these vaso-occlusive episodes are there like MI can occur, myocardial infarction can occur, stroke can occur, other any blood vessel can be occluded and will lead to certain clinical features. Another is autosplenectomy. Whenever the spleen vessel is compromised through these blood cells, so these blood cells will cause the spleen there is no blood supply to the spleen, and the spleen will continue progressively. The spleen will become shrink and become fibrosed, and the spleen will be out of functional. So in such patient, like we discussed in a previous videos, whenever we go for we go for splenectomy, we have to vaccinate that patient for the encapsulated bacteria. So in this patient also, with the autosplenectomy, when the spleen is present but it's not functioning, so we should give the vaccine for capsulated bacteria. Another is pulmonary infarction, which is the same because of the same pathophysiology of the vaso-occlusive episodes. Another is renal papillary infarction, same mechanism. Priapism. Priapism is a painful erection of the penis because of the continuous blood to the penis, which will cause the painful erection of the penis. Another is osteomyelitis. This is important for MCQs purposes. Many MCQs come on osteomyelitis. If in MCQs there is osteomyelitis, if they are asking what is the most common cause for osteomyelitis, that is Staph aureus. That is Staph aureus. But if they say what is the cause of osteomyelitis and sickle cell anemia, that is salmonella. This point is worth remembering, salmonella. If they are asking osteomyelitis and sickle cell anemia, the causative agent is salmonella. But if they are asking for the osteomyelitis as a general, that is Staph aureus. So after the clinical feature, let's go into the diagnosis. So it is like all hemolytic anemias. There will be in CBC, there will be decreased hemoglobin, and because of the hemolysis, there will be increased reticulocyte count. This reticulocyte count is normally less than 1%, or we can say up to 1%. But in this case, the reticulocyte count, which is the MHA or RBC, will be 5 to 15%. On peripheral smear, there will be sickle cells because of their particular shape of like sickles. These cells will be RBC. RBCs will be sickle shape. Another will be target cells. This is a special some type of cells in the sickle cell disease. Another will be nucleated cell, which is also called reticulocyte. This is the investigation of choice, the electrophoresis. On electrophoresis, there will be a decreased hemoglobin A, there will be hemoglobin S increase, and this increase will be much more, and there will be hemoglobin F increase. It is because of a compensation when the hemoglobin A is not forming, so there will, for the compensation, there will be increased hemoglobin F. So this is like other hemolytic anemia. The diagnosis is same. All investigation are same. Another is treatment. Treatment, the main thing is we should protect the patient from the dehydration. This all sickling shape of the RBC is caused by the dehydration, or we can say hypoxia. So always keep the patient hydrated. Never let the patient for dehydration. And the transfusion, if for example the patient is undergoing on severe hemolysis, or the HB hemoglobin is very on the lower sides, so we can go for the blood transfusion, and that should be of course packed cell transfusion, which will be only RBCs, because we don't want our patient to go on volume overload if we give the full blood, so we don't want that. Another is NSAID, because of the acute dactylitis, which is hand-foot syndrome, so that will be very painful condition, so for that we can give NSAIDs. Another is vaccine, and where any disease, whenever there is autosplenectomy, or whenever the spleen is not working, we will give the vaccine for the encapsulated bacteria. Another is hydroxyurea. This drug, basically the mechanism is not known, but it play a key role in the increase of hemoglobin F. The concept behind this is, like, we know the hemoglobin A is defective, so we don't want hemoglobin S, so we want, it's okay, hemoglobin F is also not very good for the patient, for us, so we want that hemoglobin F instead of hemoglobin S, so we give hydroxyurea to promote the hemoglobin F. And this is a definite treatment. This is a treatment of choice, is bone marrow transplantation, or we can say we can go for a gene transplantation as well. So many researches are or we can say trial is going on with the gene transplantation. So this is a like treatment of choice. That's it. Thank you so much.